everyone, and welcome to this special conversation on IVF, a journey, hope, not a promise. Today, we are diving into one of the most emotionally complex yet life changing aspect of modern medicine, in vitro fertilization. Joining us is someone who have walked alongside countless couples on this path, Dr. Amol Lunkad, a leading fertility specialist from Indira IVF Pune. With deep clinical experience and compassionate insight, Dr. Amol is here to share not just the science of IVF, but also the heart behind it. So, as part of this discussion, we will also be highlighting an important message. IVF can give you possibilities, not guarantee, but hope. So, let's begin by understanding the basics. Doctor, for our listeners who may not know, what exactly is IVF and how does it work?
Yes, Simran ji, hello, and hello to all your viewers or listeners, I would say. And yes, IVF, many of them, बहुत लोगों को ये रहता है कि IVF क्या है exactly. So basically, when the wife's egg and husband's sperm, they are not able to meet naturally, so making them meet artificially outside in laboratory in proper environment such that the embryos which are formed when the eggs and the sperm meet together, fertilization occurs, embryos are formed. These embryos can be kept back into the uterus or reposited back into the uterus, and we achieve pregnancy. So the artificial union of the egg and the sperm outside in laboratory in proper environment to form embryos, and then keeping the embryos back into the uterus or reimplanting the embryos back into the uterus to achieve pregnancy. This is in short IVF or test tube baby, you can say.
Thank you so much for that answer, sir. And sir, why is it important to say that IVF gives possibility, not guarantee?
This is true because you cannot ensure, हम ये गारंटी नहीं कर सकते कि अगर 100 लोगों ने IVF किया है तो 100 के 100 तुरंत प्रेग्नेंट हो जाएंगे. Not all 100 will achieve pregnancy immediately. Some will require natural, you can say some will require a repeat try. So not all will succeed in one go. So those who will require a repeat try will have to find out the reasons for the failure and then do basically a better, you can say, treatment ahead or another treatment ahead.
Thank you for that answer, sir. And also, at what point should couple consider IVF or see fertility expert?
Yes, so this is a very relevant question because many a times couple come very late. So normally what we say is if you are trying for pregnancy naturally without any contraception, and if you are unable to achieve pregnancy after 6 months to 12 months of your natural try, then we can label this couple as infertile. Now, even after 1 year of natural try, if you are not able to achieve pregnancy, then you should meet a infertility specialist or a gynecologist nearby. Get yourself evaluated. On बहुत सिंपल टेस्ट होती है, हस्बैंड का सीमेन टेस्ट, वाइफ के सोनोग्राफी, वाइफ के कुछ हार्मोनल टेस्ट, and you will come to know in most of the couples the reason of infertility, and then according to the reason of infertility, then you can take a proper scientific help. Now your second part of the question was which couples will need IVF or advanced treatment, because not all will need advanced treatment. Some might need very simple forms of treatment. Some might need just lifestyle modifications. Some might need just some vitamins, some hormonal support, some ovulation induction. Some might be treated with other forms of modality like IUI. But advanced treatments like IVF, ICSI would be required for those couples wherein the wife has problem in her tubes, so the fallopian tubes are blocked. तो नली अगर खराब है तो IVF या टेस्ट ट्यूब बेबी ये बेस्ट जरिया है आपको प्रेगनेंसी करने का. Second, eggs are not forming either due to severe PCOD which is not responding to usual treatment, or the eggs are very weak, eggs are about to finish, or she has achieved menopause either because of her age or sometimes even premature menopause before her age. problem, that the sperm count is very low, sperm motility is very low, or there are no sperms in his semen, or there is some problem in the form of like repeated abortions due to genetic issues, or sometimes there is no problem, it is unexplained infertility, but it is not responding to any other modality. So then again, couple should go for this advanced treatment. Certain other problems like endometriosis, chocolate cysts, multiple, you can say adenomyosis, adenomyomas, or tuberculosis affecting the uterus and the tubes. All such scenarios, again, they would be better off going for IVF. Again, those couples who have tried simple treatment for 1 to 2 years and not succeeding in simple treatment, they should again think of advanced treatment like IVF. Those couples where 3 to 4 IUI cycles has failed, again, they should immediately think of advanced treatment, because many times people keep on changing doctors but keep on trying the same treatment and waste time, money, energy before going for proper treatment. So these are the various scenarios or reasons.
Thank you, sir, for that answer. And also, sir, with this treatment and process, there are many common myths attached to it. So, what are some common myths people have about IVF?
Yeah, there are n number of myths, you can say. We can start with the commoner ones. Maybe the most common one is that IVF is the last resort always. So it is not the last resort. It is not the, you can say कि हमेशा ऐसा नहीं है कि ये last treatment ही रहेगा. अपना treatment अपने cause पे based होना चाहिए. So our treatment should be based according to the cause of our infertility. If the problem is so that this is the only best treatment, then we should go for it. Like, for example, if a couple is young, married only for 1 to 2 years, but both the fallopian tubes are totally bad, blocked, and unhealthy, then she has no other option but going for IVF. So then why waste time in simpler treatments where we know that the success is almost going to be less than 1%, and waste time, money, energy in that? So it is not always the last resort. Second, maximum couples feel that this treatment, you will have to take complete bed rest, you cannot do any activities, and you have to leave your job, be at home. So that is again a myth. We normally encourage that you do your normal activities, you keep yourself busy, you keep exercising, you keep doing normal things. There is no need of strict bed rest. So, of course, you can make your life, your job less stressful. You can concentrate on your health, your diet, exercise, but no need to take strict bed rest. The third myth is that many times couple feel that there is some mixing in the lab, the baby which is formed will not be ours. So basically, this is again ensured by the witness system. So we use a manual witness and an electronic witness. So there is a double witness form of modality wherein all, like at Indira IVF, we use the RIFD technique and sort of barcode all the gametes. So your eggs, your sperm, your embryos are all barcoded, and the RIFD card, it's sort of a credit card or a sort of a barcoded card. It is with the couple. So that ensures, this electronic witness ensures that there is no mixing. Along with that, we also use the manual witness. So such thing is basically absolutely not possible. Another myth is that a surgery is required, like laparoscopy is must, or you can say some surgery is required, some endoscopy is required before every IVF cycle. So not all patients will need a laparoscopy before IVF cycle. So these are certain common myths.
Thank you for that, answering those questions, sir. And also, does age really matter when it comes to IVF success rate?
Yeah, age is a very important point, or you can say it is one of the most important point, especially from the female side. Because as the age increases, the quantity of good eggs, the quality of eggs is going to deteriorate. And if the eggs are going to deteriorate, then the number of good embryos which are formed is going to be lesser. And if we have lesser good embryos, then our success is also going to be lesser. So, doing the things at the right age and achieving pregnancy at the right age is also very important. So that is why we say if you are tried simple treatments for 1 to 2 years, don't waste time, because nowadays couple are marrying late and then there are planning pregnancy again later. So age is very important. Third most important thing is, as the age increases, the chances of having Down syndrome, chances of having genetically abnormal baby is also increasing. So that again one has to keep in mind that age is important. But it is not that we cannot achieve pregnancy at the age of 40, we cannot achieve at 50. Even higher age, those who have had menopause, even those who are highly of very high age, you can achieve pregnancy with this treatment.
Thank you for answering that, sir. And how emotionally and financially demanding is the IVF journey for the couples?
So that is why the role of counselors come in, and that is why all our centers, counselors are there who help them through the journey. We as doctors help them, but many a times we are busy with the medical work, and sometimes what we tell may not be that much registered with the patient, or they might be, sometimes they have a, you can say, sort of hindrance with the doctor, speaking out all those things. So counselors are very important. That is why the even the ART law and the guidelines mandate that the couple should go through proper counseling. So that it is very important that they undergo proper, not only psychological counseling, diet counseling, financial counseling during this process. But overall, this journey can be means easily managed. As such, it is not very difficult or something which is going to be very, very harsh.
And so, what kind of support system do you recommend for couples going through IVF journey?
So basically, as I said, uh, all this, like proper diet counseling, proper psychological counseling, and of course, we as doctors explain them all the medical aspects, the pros and cons, overall success, process, visits, everything. Other than that, of course, there overall, you can say, husband wife proper coordination, relationship, and less of stress, concentrating more on your health, avoiding addictions like alcohol, smoking, tobacco. All these are simple things which can help us to through this journey in a better way.
So, all these things which you have explained is very insightful for us. But lastly, as we are coming into the session, any message you would like to share with those who have lost hope in becoming parents?
Yes, absolutely. I would like to tell them that plan your pregnancies at the right age, at the right time. Do not delay them unnecessarily. If you are not able to achieve pregnancy, scientifically look at the cause of not achieving pregnancy, scientifically look at the cause of infertility, get it treated scientifically, because scientifically every problem will have a proper solution. And we ourselves have given our lives for just helping the infertile couple achieve pregnancy. I would basically give my best wishes to all the couples. Not only take scientific treatment, but also uh, you have to keep in mind two, three important things. That is, do not abort your first pregnancy unnecessarily. Many times, couple have natural pregnancies, but they abort them, and then they land up coming to us for infertility again. So that is one important thing. The other is, do not you by yourself start using various contraceptives like eye pills. Nowadays, over the counter use of eye pills has gone too high. So all the such things should be avoided for your proper fertility journey ahead. And as I said, even if you have problems, take it positively. with proper counseling, proper scientific treatment, every problem will have a solution. All the best to you all.
Thank you so much, sir, for answering all those questions and educating our public, our listeners out there on this important IVF World IVF Day. With as our conversation is about IVF, a journey of hope, not a promise. Thank you so much for this awareness, sir.
Thank you. Thanks a lot. Thank you for having me. Oh.
Thanks. So just a second, sir.